Good evening, you're watching Left, Right and Centre. I'm Vishnu Som. With India seeing record numbers of COVID cases and with the number of vaccinations nowhere close to where it should be, various states are looking at innovative solutions to try and deal with COVID. How appropriate are some of these methods being adopted? Among them, the state of Goa, which has said that patients will be treated with the drug Ivermectin 12 mg for a period of 5 days. Now, the Goa government says that various panels from the UK, Italy, Spain and Japan have found a statistically significant reduction in mortality, time to recovery and viral clearance. But the World Health Organization still believes that the drug needs to be administered under emergency use conditions. Now, we'll be asking a panel of doctors whether the use of Ivermectin can cut down the risk of contracting COVID. Can it be used if you have already contracted COVID? First, a couple of details about Ivermectin itself. The drug, it's been called a wonder drug, not necessarily in terms of the use of against COVID, but certainly certain ailments after it was first discovered quite some time back. But what the Goa government is doing on the basis of some recent literature is that they're trying to apply it to COVID. Now, what the Goa government has done is that they have approved Ivermectin for preventive treatment in the state. It's been approved for all adults in Goa. The Goa government says it reduces severity of the illness and that patients will be treated with Ivermectin 12 mg for 5 days. So is this really the way forward? Joining us now, Dr. Joseph Brito. We are also joined by Dr. Hemant Thakur and Dr. Padma Srivastav. All of them extremely qualified in looking at the use of drugs in a situation like this. Dr. Brito, let me come to you first. There are journals of late which have said that this line of treatment isn't necessarily bad. For example, the American Journal of Therapeutics has said that regular use leads to large reductions in transmission. Do you believe this is an appropriate line of treatment?
Vishnu, good evening, and thank you for the opportunity for me to add my voice to the dialogue. These are desperate times, and one doesn't blame individual patients or physicians, policy makers, or in this case, Health Minister Rane, Chief Minister Pramod Sawant, in exploring whatever option might impact the impact of the pandemic. However, where Ivermectin, the drug, is concerned, the jury is out. One has to ask the question why reputed, respectable organizations like the WHO, like the US FDA, the CDC, the US NIH, the Institute of Health, why the European Medical Agency, none of whom have advocated the use of Ivermectin either for prophylaxis, which by definition means prevention, or for the treatment to mitigate the severity of the illness. And the reason is simply that there isn't robust randomized controlled trials that have been sufficiently powered, that have been well designed to show unequivocal benefit for Ivermectin, either as a prophylactic agent or as an anti-inflammatory agent to mitigate the severity of the.
Okay. In fact, Dr. Brito, if you'd want to take this question, are we hitting in the dark with the use of this medicine? We have a vaccine problem. We know Goa has a high positivity rate. Are you essentially hitting in the dark with this?
Yes, we are playing cricket blindfolded. I think, as you just said, we need to focus on vaccination. The only way to halt this pandemic and to prevent the next pandemic cycle, which will be upon us, is mass, rapid vaccination. It's not enough to vaccinate slowly over months and years. We need to vaccinate our population rapidly. And my suggestion is for all of those who are involved in policy and decision making is to focus on procuring vaccines, to sign up licensing and technology transfer deals. And as the first deliverable of this deal is to procure the vaccines. I heard on the media today, including NDTV, that both the Uttar Pradesh government and the Maharashtra government, your interview with Aditya Thackeray, that they're procuring 40 and 50,
4 doses,
4 and 5 million doses
Yeah.
of the vaccine.
Yeah.
But we need to wrap up this purchase with the licensing deal.
All right. No, I
just-
take that point. I think there is no cure to
And therefore, everything else is a distraction.
everything else.
Everything else is actually a distraction
right.
and displacement activity.
All right. Well, I'm going to continue with this discussion. I'd like to thank the three of you very much for being with